Good evening. I hope you're having a great a great day today. I hope it's been one that's been fun and nurturing. I know it's a Monday. I'm Dr. Wilkinson, and welcome to our Facebook Live Wellness Watch event, Mamas, Let's Talk, Maternal Health and Mortality. I feel like this is going to be a great conversation. They all are, but we've got some wonderful hosts and panelists tonight who are going to share what they've learned, what they've studied, what they've experienced as it relates to this topic. I want to invite you to engage. We'll be on Facebook, on the page, on the @Wilkinson Wellness Lab page, typing your questions and giving it to our panelists. I also want to invite you to watch previous wellness watches on our Facebook page @Wilkinson Wellness Lab and on our YouTube channel @Wilkinson Wellness Lab. You can also find great information on our website, www.wilkinsonwellnesslab.com. Tonight, we're discussing a very, very important topic, as always. This one severely important and is really impacting our nation. Again, according from the CDC and their recordings, 1,200 women passed away due to maternal causes in 2020 in the United States. This is up from 861 in 2020 and 754 in 2019. And these are the recorded cases. There are a number of cases of maternal death that have not been recorded, and that's important to know. It's also important to know that each and every year, many pregnancies occur, and they occur in such a way that is healthy to the mama, healthy to the baby. And thanks to medical staff and doctors, nurses, and the whole team of folks, even those that experience adverse circumstances, deliver well and receive the health care that they need. But still, problems persist in our country. Even by racial categorization, the maternal mortality rate, and we'll talk about this number, for African-American women is substantially higher than European-American women, higher to the rate that Black women die at a rate of 2.6 times the rate of white women here in the United States as it relates to maternal mortality. And so tonight we're going to discuss this issue, but we're also going to discuss how we can reduce maternal mortality, it's a tongue twister, and improve maternal health. Tonight's moderator is Ashley Peoples, a student intern from the University of Alabama at Birmingham, UAB, Community Health and Human Services Program. She is joined by our other student interns, Amanda Banco, Regina Dodson, Jessica Fagan, and Angela Wilson. I thank each and every one of you for joining. I thank you panelists for offering your time this evening. Ashley, the floor is yours, so please begin.
Good evening, everyone, and thank you for joining us all. And thank you, Dr. Wilkinson, for this opportunity and privilege to discuss this topic. This topic is very near and dear to my heart, and I know that it can be a very sensitive topic, but let's dive into it. So let's first go over a few definitions. Maternal health, it refers to the health of a woman during pregnancy, childbirth, and the postnatal period, and that is from the World Health Organization. Maternal death is the death of a woman while pregnant or within 42 days of termination of a pregnancy, and that also comes from the World Health Organization. And when we think about maternal mortality, the U.S. is a developed nation, but it also has one of the highest maternal mortality rates. So we'll start with our first question. Ms. Jessica, when we think about maternal mortality, what comes to mind?
So when you're preparing for one of the best experiences in life, which is to deliver a beautiful baby, the unimaginable could happen, which is the death of a mother due to a pregnancy-related cause. And when I also think about that, what comes to mind is me in 2006. I was at home, young, first pregnancy. I was just hurting, was in pain. Really was just thinking maybe just some breast hits or something. But my mom forced me, made me go to the hospital. When I went to the hospital, they could not find my baby's heartbeat. It was in the low 60s. So they rushed me to the emergency room. What happened, my placenta ruptured. That's when the placenta detaches from the uterus. I was bleeding internally. She was actually just floating inside of me. The doctor told me if I would have stayed at home 30 minutes later, I could have died. So when we think of maternal mortality, I think about that it could have been me. My baby was, had a serious condition from the delivery, but we both did come through with the delivery. So that what comes to mind when I think about maternal mortality. It could have been me.
And thank you for that. Thank you for sharing such a sensitive story with us. And I'm glad you both are okay. It makes me think about when my sister was pregnant with her first child. And they thought she might have been on the verge of having preeclampsia. And I had to take her blood pressure. And when I took it one night, it was, I can't remember the number, it was extremely high. And so we rushed her to the hospital. And I think within the next few days, my niece came along. And that just goes to show that to be proactive is key. So thank you so much for that.
Yeah, preeclampsia is one of the most common complications for pregnancy. That's why, especially people who have those conditions like blood pressure, it's so important to manage it. It's so important to keep checking it. It's important to keep going to your prenatal visits because preeclampsia is one of the common things that can cause maternal mortality. So yes, that's good. That's a good point that you brought up.
And thank you for that. And you're absolutely right. And I know that you are the nurse of the group. So thank you for sharing your educational experience with us and for letting us know that. Miss Amanda, when you think about maternal mortality, what comes to mind?
Well, like Jessica, I have a personal story as well, but on a national level, there was an article posted on CNN just 2 days ago about how Alabama has an F in, the score for maternal mortality. And though I hate to say it, that's not surprising to me, but it does surprise me that we're joined by 15 other states. Like you said, in the US, we think, we've got the best of the best and all of that. And this kind of proves that may not always be the case. Like Jessica, I had a situation with my second where I went for like a normal, ultrasound. I was literally like on my lunch break. I worked at UAB at the time and ran across the street to go to my OBGYN appointment. And, I was sitting there like on Facebook, just totally nonchalant about it all. And the nurse practitioner came in and she said, we need to get you to deliver today. We're going to go ahead and get you to the, she used some word and I guess I wasn't, because I'm like, what's going on? And she's like, we're getting concerned about your health now. So they're like, okay, well, we're going to send you up here. And I'm like, okay. So I'm texting my husband, hey, you need to come up here. I think they're going to try to get me to go into labor. They're going to, this, that, and everything else. And I texted my friend who worked in, the maternity and infant part of UAB. And I tell her my room number and she's like, why are you in the maternal ICU? And I was like, I didn't realize I wasn't, like it all happened so fast. I mean, they pull up a wheelchair, you sit in it and, off you go. Fortunately, everything was okay, but I found out later how bad of a risk I was. I was actually pretty high risk of my own mortality at that point because I had such excessive amniotic fluid. And, there's a number of health issues, including stopping your heart that, that can cause. So, it was pretty scary. But again, it was just like, I had no idea any of this was even a thing. And like Jessica, I don't think anything's wrong. And then all of a sudden it's like, fast as lightning. So That's what I think of when I, talk about maternal mortality. It's just, it can be anybody. It's very scary to think about, like, how quick it can all turn around.
And I definitely agree. And I thank you for sharing that. And it can definitely turn around quick. And being able to be at the hospital when it happened, and the same as, Jessica deciding to go to the hospital because she felt like something wasn't right, that was amazing. And I'm just glad you both are here and that both of your babies are here. And, I'm sorry you had to go through that experience. And I know that was tough. Regina, when you think about maternal mortality, what comes to mind?
Just as Amanda just said, it could happen to anyone. And I think about, our more well-known stars. In this case, I must share Serena Williams' story. Serena Williams' first pregnancy, she had previously had blood clots prior to being pregnant and, had thought that situation was settled, gave birth to her child, and the next day after delivery, she was telling them, I need to have a CT scan. I need to have with contrast because I'm having trouble breathing, and they weren't taking her seriously at all. They was very dismissive of her claims. They were slow to react, but she kept advocating for herself, and she kept pushing and saying, no, I don't feel right. I need you to check. I'm having shortness of breath. So in that instance, stars such as Serena Williams having the social economic ability to pay for the best doctors in the world cannot be heard, and it was not even being heard in that instance. And if not for the fact that she advocated for herself and her husband advocated with her. So it's very important that you have a partner that is very supportive of you and know you very well to be there in times that when you cannot speak up for yourself. So we do know that there's instances of single mothers giving birth and you don't have that support system, but you don't necessarily always have to be your husband or someone like that, but it could be someone that is going to advocate for you in those situations and listen to the words that are coming out of your mouth. So that's what I think of when we're talking on this particular question.
I definitely agree with that. I think her advocating for herself definitely made a difference. You have to speak up for yourself. You can't just go based on what you are told. You are your own patient advocate. And so in order for your voice to be heard, you have to push the notion and say, hey, no, I'm not okay. I'm not feeling okay. Something is wrong. So I definitely agree with that. So thank you. Angela, when you think about maternal mortality, what comes to mind?
Well, piggybacking on what Regina just said about having that advocate for you, and it doesn't always have to be a spouse. It can just be someone. When I was pregnant with my daughter and I got into distress, my mommy was my advocate, to speak for me. So I just thank God that I had her, but I think that that's a very important component to have somebody there in your corner to advocate for you. But also with the numbers that we heard earlier, I was looking around on the Center for Disease Control and Prevention, and I found out that cardiovascular diseases was one of the main contributors to women succumbing to maternal mortality. And we know that the Black women are 2.6 to 3 times higher at higher risk for maternal mortality, which is, unacceptable. So all of those are contributing factors as to why, like you said, we are a developed nation. And supposedly, I think we're supposed to be the most powerful and richest nation in the country. This isn't a third world country. So why are we having these issues? So our country definitely has some work to do.
Yes.
I definitely agree with that. You're absolutely right. And I know for a lot of people, and thank you for sharing that, their mom is their biggest support system when they are going through childbirth or going through their pregnancy. And I think about Miss Angelica Lyles, who is an Alabama native, who shared her story with the AP News. And she basically talked about the complications that she had during her pregnancy, how she wasn't being heard, and how her basically what she felt like was wrong with her was being brushed off, but she advocated for herself and she spoke up, and she had a complication to the point to where she was on a ventilator. But thank God she's better now. Her child is fine. They're both okay. But she shared her experience, and she also stated that many people in her family also had that experience. So I think it's very important that as we think about maternal mortality, to think about what we have went through and what family members went through and our friends, so that we can learn how to advocate better for ourselves, because we learn from each other.
Absolutely.
So, Jessica, what are some causes that contribute to maternal mortality?
A cause that contributes to maternal mortality is health literacy. In order to apply the information that our healthcare providers give us, we're going to have to be able to understand that information. You know, when doctors give us those warning signs and those dangers to look out for, the doctors may tell that mother, if you hemorrhage, you make sure you call your doctor or come get seen as soon as possible. Everybody may not know what hemorrhage means. Everybody may not know that means excessive bleeding. So I think health literacy is a cause. If you don't understand it, you won't be able to apply it.
I definitely agree with that. I think sometimes when we go to the doctor, even if a person does work in the medical field, I think that there should be a boundary to where things are just broken down and simplified. And like you said, say, hey, if you find yourself bleeding a lot, call the doctor, and not if you hemorrhage a lot, putting yourself in that patient's shoes.
Yeah.
So I definitely agree with it.
And even if you're in the medical field, when I was at the hospital, my daughter was sickly. When I'm at the hospital, I tell the healthcare providers, I'm not a nurse right now. I'm a mother, and I'm a pregnant mother. I'm a patient. Leave the extras behind. Those the medical workers, really, because in that experience, in that situation, you're focused on yourself and your well-being. So even if you're a nurse or a doctor, still, when it's that situation, like I said, I'm not a nurse at that time. I'm a patient and I'm a mother. Break it down.
I definitely agree with that. And it is important to separate it. You're right. When you go to the doctor, you want to be treated. You don't want to be asked about, nursing or what's, you just want to be treated like everyone else. I definitely agree with that. So thank you. Amanda, what do you think are some causes for maternal mortality?
Well, earlier when I was talking about my story, I said heart, I meant hemorrhage. It's, little tongue twisters, but yes, hemorrhaging, but also, like medical procedures. Prior to having kids, I had multiple situations where I had to have cysts removed. I had them on my ovaries and all that stuff. So, and then I go to get, make sure everything, one of them was hemorrhaging, and, how do you know? You hurt, it's painful, but you have no way of knowing if you're hemorrhaging, within a cyst or something. So I had to have surgery, and then I had to have another surgery, and then another surgery. And then when I went to get checked out, the ultrasound lady goes, huh? And I'm like, what, huh? And I'm like, what is it? What's going on? And long story short, I had a tumor. And so when I got pregnant, as my baby's growing, my tumor's growing. And so when I went to deliver, they had to do a C-section with my first, and he said, do you want me to take the tumor? And I said, will it impact my ability to have kids again? And he's like, no. I said, okay, then take the tumor. Well, it took us almost exactly 5 years to get pregnant again. And I feel like there is a correlation there. Like I don't have proof, and I'm not making any accusations, but it's just interesting that, I have all the scar tissue now. So of course it's going to be more difficult to get pregnant. And my pregnancies were, as a result, more difficult. So, kind of echoing off what was said, the whole health literacy thing, like explaining, because honestly, like while I'm wide open on a C-section, on the operating table in the middle of a C-section may not be the best time to ask me, maybe we could have discussed that prior to me delivering a baby, if you were going to take this and let me ask questions and let's have a conversation, instead of me sitting there, having a baby, you know, in the middle of going through this. And then you ask me, of course, you know, I have no idea what is even going on at that point. So, but yeah, I think, you know, medical procedures, like Jesse said, hemorrhaging, and just lack of medical, you know, literacy.
And thank you for sharing that. And I'm glad that you are okay and that you do have two beautiful kids now. And I definitely agree with that. I had a early miscarriage sometime last year, and I was having stomach spasms before I knew it. And when I spoke in depth on the phone with the nurse, and she asked me a few questions, and she then told me that was a sign of an early miscarriage, and I had no clue. I just was like, why am I having stomach spasms? Why am I feeling like this? What's going on? Just feeling really sick, a lot of heavy bleeding. And that's when I found out. So I definitely agree. So thank you for that. Regina, what do you think are some causes for maternal mortality?
Just as Jessica and Amanda spoke on earlier, our learned experiences is what kind of leads itself to having mistrust in the medical field, racism in the medical field, discrimination, being made fun of, our fears and everything just brushed aside as being unimportant, biases. And there's this misconception of pain that we are not experiencing the pain in the degree to which we're stating, and we're not being taken seriously. And it's just being dismissed in our own thoughts and feelings about what is truly going on with us. So not only with our experience, you have your mother's experience that she experienced, that she shares with you, or your girlfriend shares with you, or all of those stories come together when you're pregnant, and you think about each and every story you've heard, and you're applying that to yourself as you embark on giving birth to your own child. So even at the time when I gave birth to my first daughter, I had several friends that were pregnant about the same time, and each one of us had different pregnancies with different outcomes. And I can remember one of my dear friends' niece passed away, and we were all in fear of giving birth because it was just such an unknown, and you hear all of these old wives' tales and things like that. So that fear is already there with you. And so you go into the medical field and you're hearing all this big terminology that you can't relate to, you don't understand, because you are just a lay person. And even though today I work in what we try to have informed consent, where people know how you're going to treat them, or how the treatment is going to go in an understandable language, it still is a lot to consume in that time when you're going through it. So, as a mother giving birth and as a person that works in the medical field, I can understand it in both ways. But I do know that distrust exists. I do know that the biases do exist. And, some people don't take that as seriously, but it is very serious.
And just to echo on that, Regina, another bias that I know I've talked about a lot is education. People that may be, less educated, or, didn't complete school or things like that. A lot of times they're treated with a condescending, dismissive attitude, where, what may seem like, common sense medical stuff isn't actually common sense to everybody.
Very true, Amanda.
I definitely agree with that. I agree with both of your points. I think you both made good points. And I think that's why we should talk more, but then also ask questions. I'll be very brief. I know that I had a biopsy today for something personal. I was supposed to have had it at the beginning of the year, but it wasn't done because they say I would have been in too much pain. But once I spoke with a nurse practitioner, we found out it was because I didn't have insurance at the time, but I got the biopsy done today, thank God, and the ultrasound. And the nurse practitioner was very nice. She was very good. And she said to me, I would recommend that you go ahead and get the biopsy to make sure. And when I think about health literacy and advocacy, we have to think about those things when it comes to maternal mortality and when it comes to ourselves. No one can advocate for you but you in the best way. And it is sad to say sometimes we have to beat the door down in order to be heard. So I definitely agree. Angela, when you think about maternal mortality, what are some causes that comes to mind?
Well, and I'm glad that your procedure and everything went okay today, Ashley. Thank God you're okay. My answer piggybacks off of Regina when she was talking about the supposedly this tolerance of pain and the racial bias that exists in the medical field. I know my mom was a nurse before she passed. Well, she had been retired for a number of years, but my mom was 80. So my mom was part of the Jim Crow era in Alabama. And she was saying that they weren't even offered like epidurals or anything for pain. She would tell us these stories. And I'm like, my God. She's like, there was no voice. Your voice was whatever they told you. You're going to have your baby how we want you to have it. And she said there was nothing offered for pain. So although we have progressed obviously significantly since her time of childbearing and having kids, we still have a long way to go because we are not heard. Our voices are not heard. We can tell the doctor, communicate to the doctor, we're not feeling well, and nobody knows our bodies like we know our bodies. I don't care how many degrees and how many board certifications the physician has. I know my body when it's not working right, when it's not moving right, when it's not feeling right. But sometimes there's a huge barrier between me trying to communicate that to my physician and him receiving that information. So I think that can definitely be a contributing factor, to women getting in trouble and possibly, maternal mortality. Just, hey, hear me out, please. My body is not right.
I definitely agree. I'm very big on that. No one can tell me about my body but me. And I think that we have to remember too. I think Amanda might have said, not to feel embarrassed when we don't understand something. And even when people ask us questions, remembering that we don't owe people an explanation to explain how we're feeling, because there are some times to where people will, in a sense, make you feel like what you're saying is not true, or are you sure? And you can't always go off those opinions. So you are your own advocate. No one knows your body better than you. I completely agree with that. So thank you all for your responses. Jessica, when you think, why is health literacy important for maternal mortality, and what are some resources that are available?
Like I mentioned earlier, I think it's very important because, like I said, in order for us to apply the information that we receive from our healthcare provider, that's the only way we'll be able to, in order to apply, we have to understand the information that's given. And some of the resources that I looked up, it's supported by the CDC, the Hear Her campaign. And that campaign, it supports efforts to prevent pregnancy-related deaths. And some of the things that they support, what they promote, they have mothers talk about their experiences, things that they went through, their concerns. And, people learn from other people's experiences. It also, the campaign, encourage your partners, family, and friends to listen to you. When you say something doesn't feel right, it encourages, your family to listen to you when you voice your opinion about something's not feeling right. This campaign also, it helps the mothers to understand warning signs. Also, it helps patients manage their chronic conditions, like if they're if they're diabetic, to make sure they take care, eat properly, make sure they check their blood sugars. If they have blood pressure issues, to make sure they check their blood pressures and eat right and exercise. So the Hear Her campaign is a resource for pregnant women to look at, and it is supported in partnership with the CDC.
Okay. Thank you so much for that. And I definitely have looked at the Her campaign, and I think it's amazing. I think it actually may be led by a former retired athlete, if I'm not sure. So thank you for that response. Amanda, why is health literacy important for maternal mortality, and what are some resources available?
I think health literacy is important for the reasons that, Angela and Regina and Jesse have mentioned. I joke about, they use codes and they use terms, and, I would consider myself educated. I'm no doctor, but, I've had 2 kids. I'm in a health program and grad school. So, but, when at the time I wasn't obviously in grad school, but they started throwing around this AMA term, and stupidly, I asked what that meant and found out it meant advanced maternal age, because I was over 35. So that was one I kind of wish I had left on the floor there. But I did, I do learn, each time, you go to the doctor, like Angela said, I've lived with me at the time 35 years. I know who I am. I know what feels right, what doesn't, and asking those questions. What does that mean? But again, that kind of, you have to have a little bit of confidence in yourself. If I, had never been in school, or, was just, I don't know, if I didn't have that self-assurance, and I'll be honest, I didn't, with my first son, I did not have that self-assurance. And I remember telling, a doctor or a nurse actually, that I felt like I was deteriorating. And I remember that distinctly, saying, I feel like I'm deteriorating. I don't know what's wrong with me. I'm paranoid. Something isn't right. And she told me to keep my chin up. And, I, briefly discussed it with the doctor, and it was like a pat on the head. You'll be okay, old girl. It's fine. And I was afraid to mention it again, because I thought, I'm going crazy. Like there's something, and the medical community doesn't seem to know about it. It turns out, I was dealing with some severe postpartum, and with my second son, I got, I was a lot more confident in my skin. I had done research, I had written papers, I had done all the stuff. So I was able to stand up for myself and say, wait a second, here's what happened with my first. I don't want that to happen again. It meant changing hospitals, it meant changing OBs, but I did what I had to do. And like an army came in my room, and it was a plan in place. And here's what we're going to do. And we're going to watch out, and you're going to check in, and this is going to happen, and this is going to happen. And, but all that just because I stood up for myself. And the same is true with health literacy. You have to get okay. If you're not okay to ask your doctor, then you're with the wrong doctor. If you feel insecure, or that you're spoken to in a smug, condescending, belittled way, find another doctor. That's what I did. And I can't stress enough. And as far as resources, I think that there are just in the 5 years between my 2 kids, postpartum resources and postpartum discussions are 10 times better now than they used to be. I know that, there's a ton of international support groups. There's one called postpartum.net. And then there's one, there's tons. I mean, you can literally Google postpartum depression and find a plethora. There's also local support groups. There's one called, I think it's called Nightlight. And, you can get in there and, just if you're dealing with postpartum or something like that, and just sort of anonymously post things, because sometimes you're scared. I mean, you're scared somebody's going to take your kid. You're scared you're going to wind up in a padded cell. So, there is something to be said about that anonymity, just to know you're not alone.
I definitely agree with that. I'm sorry, Jessica, were you going to say something?
No, that was a good point. I like that.
Yeah, thank you so much. I definitely agree that it was a good point. And I would definitely say you're not advanced maternal age. I would give you that you look at least 32. So I'll give you that. I would say advanced maternal age.
Let's just back that on up. I look 28. I don't care what anybody says.
So Regina, why is health literacy important for maternal mortality, and what resources are available?
Okay, I think, and I think of substance abuse that does occur, unfortunately, with some mothers that are pregnant. And I do know that here in Alabama, they have what is called the chemical endangerment law. And that is addressed to both men and women that use or abuse drugs around in the presence of children. And unfortunately, that covers a pregnant mother. A pregnant mother that abuses drugs is more than likely to be arrested here in the state of Alabama because of the drug use. Most of the drug arrests due to kids are of women. There's 68% of the women that are arrested due to chemical endangerment is of women and not men. We do want to protect the health of the fetus. We do want to protect the health of the mother. But we do know that it is occurrences that those women that tend to abuse drugs are not women that particularly are going to use contraceptive or anything to protect themselves against pregnancy. And sometimes pregnancies are undetected until months later or weeks later. And so they have already exposed the fetus to that. I do tend to think that, this law is more geared at hurting the mother, in this case with legal obligations, whereas this mother is probably already addicted to drugs and having financial straits as a result of that. And then bringing a baby into the world on top of that makes it even more troubling. So I don't know if this law is really gonna create a better outcome for the people with the very persons we're trying to protect. So I do think that we should take a broader look at this as constituents of Alabama and the people that we choose to represent us in these laws, and just look into more of a treatment instead of a penalization program to help those mothers.
I definitely agree with that. I would definitely say that I've worked in psych, so I've been around mothers who are pregnant and trying to detox from drugs. And I think treatment is the first step, not putting them in jail, not taking their kids from them, but getting them treatment, because putting them in jail and taking their kids from them, that's going to make it worse. So I definitely agree with that. And I think that when we think about some causes for maternal mortality, drug use and addiction, it needs to be looked at. So thank you for that. Angela, what are some causes for why is health literacy important for maternal mortality, and what resources are available?
Well, when we think about what health literacy is, it encompasses the ability to obtain, read, understand, and to use healthcare information to make appropriate health decisions and follow instructions for treatment. So if you don't understand some of the issues that pertain to your body, then we all know that ignorance can definitely contribute to putting you at higher risk for these things. And that comprehension is so important. We've been talking about communicating with your doctor. I'll be the first to admit, guys, sometimes I find doctors to be intimidating. I mean, these people, they have a lot of knowledge. They're really smart. A lot of them are brainiacs. You see all the plaques and stuff on the wall. I don't know about that stuff. You know what I'm saying? Like, it can be intimidating for people. And so you kind of have to bring that down a little bit and get a physician who makes you feel comfortable enough so that you can feel comfortable with asking him, sir, well, what does that mean? I mean, you're telling me my blood pressure is 140/95. What does that mean? What are you talking about? Systolic, diastolic. What are these numbers? You know what I mean? So I think when you have a physician And I have one, thank God. But he is like the most personable physician that I've ever come into contact with. I mean, he just makes me feel like I'm his partner, and I know I'm not, because I don't know like a third of what he knows. You know, he's a brilliant man. So I think that you know, understanding and having been able to get clarification from your physician about what he means when he's talking to you. You know, sometimes doctors, I think they speak kind of over our heads, you know, and I used to just sit there and nod and say, "Oh, yes, sir," or "Oh, yes, ma'am," when I didn't know what they were talking about. But thank God I come from a nursing family. My mom was a nurse and my sister is still a nurse. Jessica has worked with my sister before at UAB. I think I was learning about blood pressure and stuff along the time that I was writing my ABCs. But that knowledge, sometimes we don't know, and we're afraid to say to this person who seems so big to us, you know, I don't know anything, you know, but you're rattling off what my diagnosis and prognosis could be. Bring it down a little bit and don't be afraid to ask those questions. Well, sir, I really don't understand that. And we all know that sometimes doctors have a time limit. You know, you got about 30 minutes to wrap it up. So if they make you feel rushed, you might want to choose another physician. You know what I'm saying? Because if you get that feeling, then you're not going to get out all of your concerns to your doctor. So that understanding and comprehension from your doctor is going to play a huge role in health literacy and help you to better make decisions about you and your body. And as far as resources being available, I found like there's a American Hospital Association. It is a great resource, and that it's an interactive website, and it gives information on ways to improve maternal care. It gives considerations for hospitals, initiatives, and like just a whole host of other educational resources and content for people to use and get more information. Empower yourself with information.
Thank you so much for that, Angela. And you're right. And I would add to that to say that health literacy is important when we think about maternal mortality, because being able to understand and advocate for yourself. And when I think about resources, believe it or not, we are our best resource. We have cell phones at our fingertips. We have iPads, we have laptops, and going to the CDC website. For people who may not be familiar with the NIH website, you can simply just type in maternal mortality and put NIH at the end, and you will have several links that pop up. And one of the resources that the NIH has is the Improve Initiative. And this initiative basically focuses on improving maternal mortality for women who are mostly affected by it. And they look at percentages, and it provides resources. So having a cell phone at your fingertips, an iPad, or a computer, you are your best resource, so that before you go to a doctor's appointment, you can look something up, or while you're in the middle of there, and you can ask them, "Hey, explain this to me," or you can say, "You know, I've been reading on the internet." So looking at credible websites that are at your fingertips, you can be your best resource. As we go into our last question, Jessica, how do we improve maternal mortality?
The way I think improve is basically just educate, inform pregnant women to, one thing I do like what Angela said, one thing to encourage mothers to be comfortable, to let the doctor know that I don't understand what you mean when you tell me this, or I don't understand what this word means. I think that's important. So I think way we can help is just educate mothers to be comfortable to let your doctor know that you don't understand something, and and just encourage the mothers to take care of your body, go to your prenatal appointments.
I definitely agree with that. Thank you for that. And I think definitely mention the prenatal appointments are very important because sometimes a lot of women may miss those appointments, but it's very, very important to start off with a strong kick so that you can have the best pregnancy as possible that you can have, because everyone's pregnancy is going to be different. So thank you for that. Amanda, how do we improve maternal mortality?
I think that having, comprehensive sex education would be a huge step to improving maternal mortality. I used to work in financial aid, and it blew my mind how many people knew nothing about financial aid. And that's not near as personal as sexual history or sexual education. And I think that there's so much stuff that could be, an ounce of prevention is worth a pound of cure kind of thing, that if teenagers knew about birth control and what that means, and yes, you do have to take it every day, or yes, you do have to put it on, and there is an incorrect way to do it, and things like that. I think that would hopefully help a lot, but also just advocating for, community reach programs. If I had my way, there would be somebody in every pediatrician office scanning the moms, seeing if they're showing signs, is the mom checked out? Is she okay? Like there would be somebody, while, Bebe is getting checked out over here, somebody pulls mom aside and is like, how are we doing? What's going on? And that would be, a dream come true of mine to have like one of those in every, because I know for me, I'm a lot more likely to take care of my child than I am myself. So I'll go to their appointments. I might miss mine, but I'll go to theirs. And so I think just advocacy and just knowing that, everybody can bring something to the table. You can start a Facebook group. You can start a campaign at UAB. You can start, there's ways that even us lay people can, promote different ideas, but I definitely think it starts with education, and I think it starts with the youth.
I definitely agree with that. And I definitely think that as graduating community health students, I think that maybe on our part, maybe there are certain surveys that we can help create to ask certain questions, or maybe understand what some people are going through that may be barriers to preventing them to getting the care that they need as they prepare for maternal, as they prepare to be mothers. So I definitely agree with that. Regina, how do we improve maternal mortality?
I'm always a staunch advocate of voting. Vote for people that are going to represent you and represent your well-being, your present self as well as your future self. What would you want for your future self, your future generation? So when you're looking to vote for someone, you look for someone that embodies those same ideals that you have. And so it's just as simple as that. When you have someone that has the same ideologic viewpoints as you do, then they're more apt to have laws that mirrors what you want for yourself as well as your community. So I can stress voting across all kinds of spectrums, especially maternal health.
I definitely agree with that. I definitely think that we have to get out and vote, look at who we putting into the office, what is their platform, what are their agendas, how do they view maternal health. So I definitely agree with that. So thank you. Angela, how can we improve maternal mortality?
So I think there's a few things. We talked about the disparities previously. So I think one of the things we need to do is acknowledge those disparities that exist, address why they exist, and then commit to reducing these disparities. So there's going to have to be conversation and dialogue that's going to have to take place with all of our physicians. And, I bragged on my OBGYN previously, but we've had these conversations. He's an older white man. He grew up in Mountain Brook. I grew up in Vice Hill Projects. So night and day. But we sit down and rap, and he'll actually ask me, like, what do you think? Like, do you think I'm doing everything I could do to kind of bridge some of what we're seeing statistically. So those type of conversations are going to have to happen. And then on a personal note, now remember back in the day when you had a baby, they would keep you for observation like 3 or 4, 5 days or whatever. Now you had that baby, I mean, the next day, if you can stay the next day, you got to go. So how about let's keeping the women in who's delivered in the hospital for observation a little longer than just an hour after they had the baby. And I know that it all comes down to insurance, and I ain't dinging on the nurse, Jessica, but I'm just saying, I think y'all kicking us out a little bit too soon. You know,
I agree.
yeah,
I do.
we've just almost come to death, and here we are. Okay, you're fine. You know, your blood pressure's good. Go. The next day, or sometimes the same day. I think we need to, take a second look at that and see if, we can improve some of these maternal mortality rates by a little bit more observation and letting us stay a couple of days over in the hospital.
I definitely agree with that. I was born in 93, so I think my mom might have stayed at the hospital maybe a few days.
Oh, you're one of those.
Yeah. I'm a millennial, but
Okay.
I can say that just turning 30, even though I've had experience with a loss, wanting to have kids, maybe hopefully in a couple of years, working on my health. So exercising, making sure that you're getting exercise in. If you go to UAB, I love the Peloton bike. They have 2 Peloton bikes. You can create you an account. If you have an iPhone, and they have a free app for the Nike training app. So getting any exercise in, going walking, have you an accountability partner, but having great maternal health definitely starts with exercise, knowing what your blood pressure is, what your heart rate is, and making sure that you are up to date on the American Heart Association guideline for the recommended blood pressure that you should have. At one point, it was 120/80. Now, I think it is a little bit less than that. I'll have to go back and check. But thank you all so much. I appreciate you all. I'm going to turn the floor back over to Dr. Wilkinson.
So I am going to second what's been said already. Great job. This has been a very informative and enlightening discussion. I learned a lot. I really appreciate your sharing of your experiences. Ashley, thank you once again for your moderation and facilitating tonight's discussion. Panelists, thank you for your sharing of your personal experiences and your research that you've done on this topic, because it's a very important topic. We do see great disparities in this topic of maternal health and maternal mortality. And I think it's something that we can address. I think everybody in the country, doesn't matter what your background, what your values, we can get behind mothers and children. And that's what we want. We want healthy mothers and we want healthy children. And so I don't think that this is an issue that should separate us. I don't think that this is an issue that should divide us. I think this is an issue that we all have in common and that we all can get behind. So we can come together and bring down the disparity that we see as it relates to maternal mortality. We can come together and, as y'all said earlier, investigate what's really going on. What are really some of these stories and experiences, whether it's experiences in the medical system. We have great doctors, we have great nurses, we have great medical care teams who are really doing the great work in support of our mothers and our children. But we're also human and we make mistakes, or we say the wrong thing, or we treat people worse than they should be treated. All of this is correctable, if that's even such a word. I probably just made it up, but we can correct it. We can do better. We can do better as it relates to medical mistrust. We can do better individually as it relates to understanding pregnancy, reading books, reading valid websites as it relates to understanding what to expect when you're expecting. Everybody remembers that book, right? We can support our doctors and our nurses by communicating with them, but they have to listen too, right? Because if we communicate and they listen, and they have expertise, as Angela said, then we can come up with the best solution for our own medical care as a care team together. And we also have to worry about the physical health concerns, the mental health concerns. And that's where being each other's advocate, having someone else as a partner going with us through this journey, having a support team, a care team around us, involving our faith-based groups, involving our families, and really just, you know, making sure that we have a nurturing environment around us is important to addressing these maternal health concerns. So I thank you tonight for engaging, and for those of you who will watch this by video, I thank you for also engaging and sharing this with your people and on your Facebook, Instagram, on your different media channels. We'll have more information at www.wilkinsonwellnesslab.com, and we'll also have this on our Facebook page and YouTube channel. Again, I thank you for, you know, engaging with us. Panelists, I thank you for the wonderful job you did. Ashley, I thank you for what you're doing, and I'm excited about your future as well as you're graduating. Thank you all. Have a wonderful evening. And as always, let's live well and be well. Good night, everybody.
Mhm.
Good night.
Night.